On November 6, 1880, Charles Louis Alphonse Laveran for the first time identified malaria parasites in the blood of patients with high fever. Today, on that same date, we celebrate Malaria Day in the Americas.
This is a scale model of the mosquito Anopheles. We use it to educate people about malaria transmission.
Now in its second year, Malaria Day in the Americas is an opportunity for countries in the region to launch a dynamic campaign against malaria that will last throughout the year. In the Americas, nearly 142 million people are at risk of contracting malaria, and almost 1 million people contract the disease each year. The situation is more serious in 21 countries of the region, but other countries remain at risk of outbreaks and the reintroduction of local transmission.
People still die from malaria. I have seen patients get to the hospital in a coma, and many of them died. But the situation has improved. The health services are getting better, and the demand for services is being met. The diagnosis and treatment has also improved a lot.
Everyone is vulnerable, but those at greatest risk are pregnant women, children, and people with HIV or AIDS. Also at higher risk are miners, loggers, banana and sugarcane plantation workers, indigenous groups, populations in areas of armed or social conflict, and people living in border areas. The disease can also affect travelers. Climate change threatens to increase the spread of malaria into new areas. Malaria generates poverty and underdevelopment in vast regions of the world, including the Americas. That is why malaria is seen as a global burden that requires a global solution carried out through local action. Essential supplies for the prevention, diagnosis, and treatment of malaria must be available to communities when they need them and must be used appropriately.
The health workers come here to check on the people affected with malaria. Then, they send some other workers to collect blood samples, analyze it, distribute medicines, supervise that we finish the treatment. Then, they move on to another house to check on other patients.
Health workers and patients must strictly follow the guidelines for diagnosis and treatment. Malaria treatment reduces deaths, disease, and poverty, and also improves the health and productivity of communities, helping them to help themselves. Governments, corporations, international institutions, foundations, and non-governmental organizations must work together in an integrated way to broaden the fight against malaria. Investing in the fight against malaria has produced proven results. The year 2008 is one of opportunities. International partners in the fight against malaria are stepping up their efforts to achieve the goals of the Rollback Malaria Initiative by 2010 and to meet the targets of the United Nations Millennium Development Goal related to malaria by 2015. Countries where the problem persists are accelerating cooperation at the national, regional, and international levels to secure malaria funding from the Global Fund to fight AIDS, tuberculosis, and malaria. But even more help is needed, and we are seeking that help. Between 2000 and 2007, cases of malaria in the Americas declined by 1/3, and mortality declined nearly 40%, thanks to the adoption of newer, more effective drugs and the use of insecticide-treated mosquito nets, many of them distributed with support from the Global Fund.
In 2003, we reported approximately 20 to 25,000 cases of malaria in this municipality alone. This year, we reported 6,000 cases of malaria.
In addition, 5 countries have already met the Millennium Development Goal targets related to malaria, and 6 countries have met key targets of the Rollback Malaria Initiative. Many countries have strengthened malaria control, and at least 4 are well on their way toward elimination. As this year's slogan says, let's unite against malaria and work together to overcome the challenges of a disease that knows no border.